I'm the ERA PerMed coordinator, Cristina Nieto, from the National Health Institute, Carlos III from Spain. And I will briefly introduce ERA PerMed afterwards. After our colleague, Dr. Monika Frenzel will present you as Joint Transnational Call Secretariat 2022. She will present you the new call, the official documents, the procedure, and the main goals of this call. And afterwards, we have included two presentations of two experts. Dr. Erich Griessler, that is expert in ethical, social, and legal aspects, and Dr. Laetitia Bracco, that is expert of good research, of data management and data management plans. Due to the availability of Dr. Bracco, that she had to leave us earlier, we will switch afterwards the two talks of today. She will present first the data management aspect, and afterwards Dr. Griessler will present the ethical, social, and legal aspects. So ERA PerMed is the ERAnet on personalized medicine. I'm the ERA PerMed coordinator, as I said before, and I represent the National Institute of Health, Carlos III from Spain. Thank you very much, all of you, for your attendance to this Infoday presentation of our next ERA PerMed Joint Transnational Call 2022. ERA PerMed is the biggest ERAnet in health. It's an ERAnet in personalized medicine, as I said before, with a time frame of 6 years, thanks to the 1-year extension provided by the European Commission. Its consortium has 32 funding organizations from 23 different countries, counting 19 European countries, 3 associated countries, 1/3 country, Canada, and 5 regions. And in total, 5 joint transnational calls will be launched under the ERA PerMed program. The first one, a co-funded call, co-funded by the European Commission, and 4 non-co-funding additional joint transnational calls in 2019, 20, 21, and next year. The coordination is under our institution, the National Institute of Health, Carlos III from Spain, that I represent. ERA PerMed is an ERAnet co-fund with a contribution by the European Commission around 9.5 million euros that serves to coordinate regional and national funding efforts that are able to support personalized medicine multidisciplinary transnational research projects. We promote the scientific excellence through peer-reviewed transnational calls. And so far, more than 100 million euros have been invested in personalized medicine research through our ERA PerMed calls. We have developed transnational collaborations since we count with the additional funders that have joined our ERA PerMed calls, such as Taiwan, Greece, Egypt, Panama, Brazil, Chile, the Spanish Association Against Cancer, etc. And we as well has developed synergies with current and future European and international initiatives, such as the Future Partnerships or the Cancer Mission, ISCIII, stands for PerMed, etc. As it was stated in the Strategic Research and Innovation Agenda of PerMed adopted by the H 2020 Advisory Group, personalized medicine refers to a medical model using characterization of individuals' phenotypes and genotypes, such as molecular profiling, medical imaging, lifestyle data, etc., for tailoring the right therapeutic strategy for the right person at the right time, and or to determine the predisposition to disease, and or to deliver timely and targeted prevention. And as a personalized medicine is non-specific of a condition or a disease, proposals from any medical research area are encouraged to participate in our ERA PerMed calls. Here is an overview of the joint transnational calls that have been launched so far under the program of ERA PerMed. The first one in 2018 was a co-funded call, and 3 additional non-co-funded calls have been launched. And next year we will launch our last joint transnational call that it will be focused on prevention in personalized medicine, and it will be presented afterwards by Dr. Monika Frenzel as Joint Call Secretariat of this new call. In its call, the Joint Call Secretariat is hosted by any partner of the consortium and any a different institution, and around 25 million euros are invested in its call for requested for funding research on personalized medicine. PerMed has been really successful funding personalized medicine research project. As you can see in the graphic, the competence is very high. We receive around 200 proposals in the first phase. These pre-proposals are selected to undergo to a full proposal phase. And finally, around 20-25 proposals are funded each year in each call with a requested budget around 25 million euros. So far, we have funded 87 projects with more than 100 million euros, counting with 7 million euros as a top-up in the first co-funded call. As you can see in the graphics, the regional participation has been really successful in this call. We count with several European regions that are, and also Quebec from Canada, that are members of the European PerMed consortium or have participated as funders in our calls, and they have achieved a very successful participation for the research projects. While setting a not so high requested budget, they have been able to fund partners in a great deal of consortia. For us, regional participation is key in this for the personalized medicine implementation. So it's very important that regional partners are included in the consortia. As well, we have developed a very relevant international dimension in our calls, since the PerMed and ISCIII PerMed International Consortium for Personalized Medicine are closely connected because PerMed is a member of the ISCIII PerMed family, together with several CSAs that are focused on different aspects of the personalized medicine, including the international aspects. This is very important since personalized medicine is a global topic. Therefore, the participation of funders in our calls or researchers from third countries are considered as an added value. Those are the main outcomes and impacts that we have achieved in PerMed. We have developed a successful alignment on a common strategic agenda for personalized medicine research and innovation. We have provided new scientific knowledge and better evidence for personalized medicine for different diseases while funding research projects in personalized medicine. Through the flexible call design that we have developed, this has allowed integration of the different key stakeholders in the personalized medicine field that can cover the entire value chain and also facilitate the knowledge transfer. We have also promoted clinical research with a personalized approach, taking into account that the patient stratification in the clinical studies. We have also enhanced the development of big data and analytic tools, standards, and sharing of data and outcome results, always following fair data principles. For us, the communication and visibility also of the PerMed programs, but also the funded research projects in its call is very important. Therefore, we have developed several channels for communication as our website or our Twitter account, and also published periodical newsletter that cover a summary of the funded research projects in PerMed calls. Also with event representations, Infodays as today, videos, etc. And which will be the future for PerMed? PerMed will end in November 23, and we hope that it could be integrated in the new European Partnership for Personalized Medicine, EP PerMed, that will be in the future. As we consider that all key stakeholders in the personalized medicine field need to work together to bridge the gap between personalized medicine research and its implementation in the healthcare systems. Thank you very much, all of you, for your attention. Here is the email address of the coordination unit where you can consult any doubt that you have. Thanks a lot. And now I will give the floor to my colleague Monika Frenzel, that she will present you the PerMed call 2022.
Thanks for the transition for the Joint Transnational call 2021, and it's my pleasure to present to you this call that is on prevention and personalized medicine. So my name is Monika Frenzel. I'm international coordinator at the French National Research Agency. And yes, we are this year your call Secretariat, and we have a kind support from our coordination team ISCIII from Spain. It's a dense presentation, and we will focus mainly on the more technical aspects here. As it was mentioned by our coordination team, please include your questions in the question and answer section. If you have really specific questions to your project, to the research field, potentially this is better to do this by email and to have a direct exchange on it. But if you have general questions around the call, we hope that you give you here first input, and if you have questions, of course, to the general frame of the call, please do not hesitate to ask questions directly here so that we can try to answer most of them if possible. And I hope one of the questions I saw was the difference to another call. I hope that this presentation will already help you to see the differences between this call in terms of the scope compared to other calls as Transcan, for example. So in this call 2022, 33 funding organizations agreed to participate from 26 different countries, 18 EU countries, 3 associated countries, 5 third countries, and 1 charity coming from Spain. I will not go through the list in detail. You can find all this information on the PerMed website. We have also 6 regional funders participating from Belgium, Germany, Spain, and from Italy. Your Joint Call Secretariat, as it was mentioned before, is ANR. This is your central contact point if you have general information about the call. And of course, you have your individual funding organizations that can also help you when you have questions. The Joint Call Secretariat consists of Michael Joly, who's also here in the telco today, and myself, so we are happy to receive your questions. The initial commitment for this 2022 call is 29 million euro approximately. Here you can see the general call calendar as a table. So we already launched the call. And please take care about the very important aspects that are concerning you particular. So this is the first phase, the submission deadline for pre-proposal. So as we are in a 2-stage process, we have 2 submission deadlines. So the first one is on 17th of February next year. And please take care, there's even also a time frame where you have to submit it. It's at 5 p.m. Paris time. So please take care to submit your proposals in time. Then you will get a contact or a feedback from us around beginning of May, mid-May, where we communicate to you the outcome of this first phase and invite a part of the proposals as every year for the full proposal step. Full proposals have to be submitted to us until 14th of June. Also here it's 5 p.m. Paris time. You will have the possibility to read the written comments in the full proposal stage from the reviewers and to comment on this before the reviewers are coming together in the panel meeting. This will be mid of end of August, so please take care that you are available in this time and that you can take part of this rebuttal stage. The reviewers and the funders are joining in September, and we hope to have the final decision by October, latest in November next year. And projects should start. end of the year 2022, beginning of 23, depending on the regional and national funding regulations, of course. So you can find all information on the ERA PerMed websites, and please take care that these are also often the more recent information. So we have some updates sometimes for the core documents. So please, if you would like to have the most recent documents and information about the call, please refer to the ERA PerMed website. There you can find information about the electronic submission tool that is called PT Outline. You can find information about the Secretariat of the call and also about the different individual funders. You can find the call documents and also general information about the call and eligibility criteria. And also we provide you some information about a tool that is called Partnering Tool that could help you to find also potential partners for your consortia. So I have some more slides on this at the end of the presentation. So the public call documents are the call text, the guidelines for applicants, the pre and the full proposal application form. The first three documents are already available on the ERA PerMed website. The call text includes the scope and explains you what we expect from proposals submitted to this call. While the guidelines for applicants are giving you general information about the call and also are giving you all the information about the individual funders. And please have a look on it because you find the different regional and national funding regulations outlined there. The pre and the full proposal application forms, they have to be uploaded on the electronic submission tool. And please take care that information included in the pre and full proposal form are coherent with the information you include on the PT outline form. Other public documents are an annex on exploratory clinical studies that will be available at a later time point for the full proposals. And if you are working on an exploratory clinical study, you have to fill out this template and upload it on PT outline as an annex. We will also share with you the template for the data management plan from ERA PerMed that will be requested only from those projects that are finally funded. But we are giving you this information before, and we are happy here to have Laetitia Bracco, because it is important that you outline the data management plan and start to prepare it even in this phase of project preparation and not when the projects are starting. Yes, and this is really a very, very important message. Read the call text, read the guidelines for applicants, go and contact your national, regional contact points before you are starting constructing your proposal to be sure that you are compliant with all the different formal requirements. It would be a pity that you are developing a proposal and finally it is not eligible due to formal questions. Some funders, they have also specific requirements besides those from ERA PerMed. So please check for the guidelines for applicants, and you can also download some of the documents that are required on the ERA PerMed website. So for example, for applicants coming from Italy, from Spain, and also from Israel. But there are potentially also other requirements, and please check for this carefully, the guidelines, and contact your agencies. To dive a little bit more in the 2022 call. This call will be is concentrating on research on prevention and personalized medicine. We would like you to develop tailor-made strategies for prevention of disease and disease progression at 3 different levels. So this is not that you include all of them, but you can concentrate on one specific level. Either primary prevention, secondary prevention, or tertiary prevention. You could, on top of this, include also prevention from over-treatment or over-medication. This is optional, and please include it only if it's really fitting to your proposal. So this is optional. In general, ERA PerMed is fostering transnational research projects in the field of personalized medicine. We encourage and enable interdisciplinary collaborations towards implementation of personalized medicine, and in the 2022 call, specifically by combining preclinical and clinical research with bioinformatics component and social sciences like ELSA research or implementation research, including health economics. And also we encourage a collaboration between academia, clinical and public health research and private partners. We expect proposals submitted to this call to demonstrate the applicability of the project outcomes into clinical practice, and also to describe the impact on the healthcare system. As our coordination team already outlined, every disease type is welcome. So we are not giving you any restrictions on the type of disease you would like to work on. You might know already, if you are familiar with PerMed calls, that we are constructing the calls around 3 research areas. So this year we also kept the 3 research areas like in the last call. And we have a kind of module system and 2 modules this year per research area. The first one is translating basic to clinical research and beyond, with 2 modules, preclinical and clinical research. Research area 2, data and ICT, with 2 modules, enabling technology towards application in healthcare. And research area 3, responsible and effective implementation in healthcare, with 2 modules, health economics and implementation support, and ethical, legal, and social aspects. We request, and this is mandatory, that projects submitted to this call have to integrate at least 1 module out of each research area. So we want a combination of the 3 research areas in submitted proposals. The choice of the modules is yours in each research area. But what is really important is that we are the coherent integration of the different research areas is really part of the evaluation process. And please take care, and this is what I repeat potentially more than 1 time in this presentation, not all funders are funding each, or not each research area or module is eligible for each funder. So please take care. So here you have also just an extract. Please visit or see, read the table at the end of the call text that is showing you, we hope in an easy way, which funder is providing funding to which research area. So check this carefully, and to help you in letting us know, in fact, how you integrated the different research areas in your project, you will find in the pre and the full proposal template this table. And we would like to that you construct your proposals the way that you have dedicated work packages corresponding to different research areas or modules, and that you indicate in this table the work package created for the respective module or research area, and who is the expert in your project for the respective research field, who is the main responsible person and who is working on this. Especially also this is helping us and the funders also to verify eligibility criteria also. And for us, it's important because the coherent integration of the different research areas is mandatory. And this is also why we are really happy here to have Dr. Erich Griessler as expert speaking afterwards, who is a little bit or helping you also to give you some input on how to efficiently implement research area 3, so that it's more on, let's say, the social sciences aspect in your research proposal. Yeah, we are, PerMed in general allows different project partner categories from academia, clinical, public health sector, private for-profit and private non-for-profit partners. PerMed would like to that you integrate, if possible, partners from each of the different categories in your research proposals to have this multidisciplinary character or this is connected to the multidisciplinary character of the call, and we think these different expertises are needed to bring really personalized medicine forward. Of course, the selection and the choice of experts and partners should be coherent to the project topic and proposal that you are developing. So it's you should have the right partner composition to achieve your scientific goals. And again, please take care that not all funders are funding all the different categories. So please take care and check this point with your respective regional and national funding organization. So other eligibility criteria. Of course, PerMed is a transnational program. So also proposals submitted to this call have to be transnational. You have to have at least 3 partners coming from 3 different countries and, well, 3 different entities that are participating in the proposal. At least 2 partners of these partners should be, or of the consortium, should come from an EU member states or associated country. You can integrate maximum 6 partners in the first stage and maximum 7 partners, and only if you integrate a partner from an underrepresented country in the full proposal stage. So underrepresented countries are those that have had a low participation in the first stage, or at least a low participation of partners in the second stage. So the countries that are considered in the 2022 call as underrepresented countries will be available at the full proposal step. Then other eligibility criteria. The project coordinator has to be eligible. There's no co-coordination allowed. And this is new in the call. We would like you to integrate at least 1 early career researcher as principal investigator, and you can find the definition of early career researcher as annex in the call text. You can integrate a partner that is not requesting funding. So that could be a partner, for example, that is simply not eligible to receive funding from his or her funding organization, or that is coming from a country that is not participating in the call. This partner has to provide in the second stage a letter demonstrating or assuring that he can participate in the project with his own funding. You can integrate maximum 2 partners from the same country in the consortium. And please take care that some funders are even only funding 1 participant per project. Yeah, so we have exceptions in this 2022 call. With that, you can break some of these rules, but only if you integrate the patient organizations. Because we noticed that integration of patient organizations is quite complex, and to help you to better integrate this type of partner, you can break some rules if you integrate a patient organization in your consortium. So for example, you can have a consortium bigger than 6 or 7 partners in the full proposal or pre-proposal stage if the additional partner is a patient organization. You can have more than 1 partner participating on own funding as soon as you have 4 or 5 partners in your consortium. If this additional partner participating on own funding is coming or is a patient organization. You can have up to 3 partners from the same country, but only for those countries where you have more than 1 funding organization participating in this call. And only if 1 of the 3 partners, of course, is a patient organization, and only if 1 of the 3 partners is asking funding from a regional funding organization. So it sounds complicated, but please have a look on the call text, and this is all outlined here. And if you have questions, just come to us and ask us again. Some contents or some aspects are formulated mainly as recommendations and that are strongly encouraged. So for example, this includes the active involvement of members from the public, for example, patients, citizens, potential patients, healthcare providers, health and social care services users, as well as patient organizations. Then we also would like to, well, and for this first aspect, we tried to make the call rules a bit more easy so that you can better integrate this type of partner in your proposals. And then we request you to integrate reflections on sex and gender consideration, on underrepresented populations like ethnic minorities, and also underrepresented patient subgroups like children or elderly person inside your research, but not only, also inside your research teams. So please take care and consider these aspects. And I would like to remind you that these are also aspects that are asked for the reviewers to verify So even if they would not apply for a certain reason to your research that you propose, please outline it and let us know why you are not considering or cannot integrate a certain aspect in your proposal, because for that and that reason it might not apply to your research. But please take care that we really encourage you to take these aspects up into your research proposals. We try to help you to understand what we expect from research proposals submitted and what is outside of the scope. And let's say, so this is in the call text, you find the section in the call text. And I would say the first 2 bullet points are mainly underlining that we are here in a call on personalized medicine. So you have to include individual measurements, individual risk assessments. So we would like to learn something about the individual risk. And also, so the research should go beyond generic health promotion research or public health practices that could be applied to society as a whole. Then we allow small-scale exploratory clinical studies, but not large clinical trials. In general, the points below that are with the red crosses and showing what we don't want are kind of repeating what I just said. So we expect that we have studies on personalized medicine, that you, of course, respect the multidisciplinary character, that the studies cannot be long-term. You have to finish them in the 3 years time frame. And the studies should go or should not be typical health promotion research or public health practices projects. Yeah, so for the more technical aspects, you have the online submission tool where all the submissions have to take place. So we don't accept anything by email. It is the coordinator, the only person that should connect to this tool, and that is responsible for submitting the proposal. And also the pre and full proposal application form has to be uploaded on this tool. Everything has to be prepared in English. We have dedicated sections in the pre and full proposal application form that have to be respected. So if you are not respecting the length limits, your proposal is also could also risk to be not eligible. So please take care of this. Also take care that we in the first stage only asking the signature of the coordinator, but you have a little bit more heavy administrative step in the second phase. We would like to have the signatures from all PIs in the full proposal form. And of course, take care of the submission deadlines. And please, again, I can only repeat it again, please take care that whatever you integrate as information in the PT outline submission tool should be identical to the ones that you integrate on your pre and full proposal form. We allow you to upload additional annexes. So for example, one annex that concerns only Spanish applicants that are applying funding from ISCIII and FCACC. Then you can upload also through the PT outline form the letter of commitment that I mentioned for the partner participating on own funding. You can also upload supporting letters if you have like an advisory board or something like this developed. You can upload it there too, or endorsement letters. So please put them in one single PDF and then you can upload them. And also you can later on upload the exploratory clinical study document there. After all the submission stages are finished, we will start the evaluation. For this, we have external experts that are invited and that are, of course, allocated to the proposals and fitting to the research performed. We have 3 evaluation criteria, and I'm not outlining them more in detail, but please check them in there in the call text. And especially when you develop your proposal, have a look on the criteria also, because that helps you also to understand what we ask the reviewers to evaluate. So check if your proposal includes all the different information that we are asking also the evaluators to evaluate. So these are 3 criteria: excellence, impact, quality, and efficiency of implementation, with sub-criteria that I just said you find in the call text. And the scoring system is from 0 to 5 for each criteria. The outcome of the evaluation will be communicated to the coordinators by the Joint Core Secretariat. You will receive the written evaluations and you will not receive the scores. So this is something that we are not communicating. For full proposals, you will receive additionally, after the reviewers met, the consensus report as outcome from the peer review panel. This is in general, again, let's say the framing in a more visual way of this call and on the timeline. And I just would like to underline, I think you don't see my mouse potentially, no. In the full proposal stage, so it's the blue square also that is down on the slide. This is the moment you can include a last partner to your proposal. And this is for, or the partner should only come from an underrepresented country, and we will provide you the list as soon as the first stage of the call is finalized. Yeah, I'm a bit already over the time, but I would like to spend a few minutes on the consortia, so how you can apply, in fact, to all the requests we have to you as applicants for this call. So we ask you to be multinational, we ask you to be interdisciplinary, we also ask you even to be intersectoral. And well, there is one tool that might help you to create your consortia. And this tool is called ISCIII PerMed Partnering Tool, and you have the link here, and it's also on the PerMed website, so there you can find also the information. And what this tool allows you is to integrate information about you. So your name, of course, if you're academic, clinic, what is your research area, where do you come from, you can describe your work, keywords about you, even your some things you published, and also what are your competences. And you can also integrate, if you are interested in, for example, participating in call for proposals. When you entered all this information, you have access to the tool and you can actively search for partners, and the others can also see you and your profile if you would like to. And so you can integrate or tick different filters, and you can get a table of potential partners that are, well, in this tool, and that potentially, well, that you could contact and see if they are interested to participate or form a consortium. So we think this partnering tool is really nice for consortia that are already maybe well established, but they search for a specific partner. Maybe one module they would like to integrate and they don't have yet a partner working in it. Then also for an individual applicant that is searching for a consortia or would like to start forming a consortia. We think this is especially maybe nice. I saw we have also some participants coming from South Africa in this webinar. So especially for those participants coming from countries that were recently joining the PerMed calls, like Brazil, Chile since 2021 already, but Lithuania, and by the way, I would like to announce that they are officially part of the call. So the participation of Lithuania is not pending anymore. So Lithuania, South Africa, and Taiwan, these are also 3 new countries that participate in this call. Maybe participants, applicants from these countries, you could also, for example, join the partnering tool and well, increase your visibility through this. And also in the second stage, potentially it could be interesting for participants coming from underrepresented countries, so that are not really well presented yet in research proposals submitted to this call. So last year, this was, for example, Chile, Croatia, Egypt, Saxony, Latvia, and Turkey. This year could be others, so we don't know yet. But we just would like to let you know maybe that this is a nice possibility to get some visibility also if you feel that your country is not really well represented in this call. And this is my very last slide, and maybe the take-home message. I didn't went so much into detail. I apologize for the scope. So we think that this is potentially something where you have specific questions that are better addressed directly to the core secretariat. But we hope that we helped you a little bit to understand the complexity or the technical aspects more of this call. But if you have questions, please do not hesitate to contact your regional national contact point. Of course, contact the Joint Core Secretariat whenever you have general questions. And please read carefully the call text and the guidelines for applicants and the general eligibility criteria of the different partners, the funding organizations. And this is really a recommendation where I think this is important. Personalized medicine is the topic of ERA PerMed. Personalized medicine is a topic of this call. Outline clearly what is, especially in this field of prevention, what is the personalized medicine perspective in your proposal? Because this is, in fact, the main aim of this call. Yeah, and I think with this, I'm at the end of the presentation, and we are sincerely looking forward to all the exchange this year and to receiving your applications. Thanks, Cristina.
Thank you very much, Monika, for your presentation. We have received a great deal of questions already. We will try to answer them afterwards. We will pass the floor first to our experts. Dr. Bracco had to leave us very soon, so she will present first. We will try to ask questions to her before, in case that you have some of them before she leaves, because she cannot stay longer. Thank you very much, Dr. Bracco. The floor is yours.
Thank you very much for the invitation. And again, I'm so sorry for this obligation I have at 2 p.m. In France. So hi, everyone. I'm Laetitia Bracco. I work as a data librarian at the University of Lorraine in France. It's in the northeast of France. So I'm here to talk to you about good research data management. And I'm here to convince you that research data management is your best friend all along your project. So a short presentation, what is a data librarian doing? Well, I'm helping researchers and PhD students on the subject of data management in general. That's why I'm doing some trainings and also individual help for all topics regarding data management. I'm hosting data management plan workshops, for example, and I'm reading and improving DMPs for funded and also non-funded projects in my university. I'm here today because I'm an expert for the ERA PerMed consortium. I'm currently reviewing DMPs for ERA PerMed funded projects, and among other things. So first, what is a DMP? So DMP is the acronym for Data Management Plan, and it's now required for most funded projects. Of course, for ERA PerMed calls, as you've seen, but also for a lot of funded projects in the world. In France, the National Research Agency is requesting DMPs, for example, and also the European Commission as well. So it's a formal document which includes a list of questions regarding all matters involving data. For example, which data will be reused or produced during your project. It can be measures, experiments, I don't know, videos, sounds. It can be a lot of things. It's all the data that you will use to publish the data you will rely on to produce articles, books, etc., etc. One question that is also very important in DMPs is about the methodology, quality controls, and metadata you are using to describe data. You have also questions such as where will data be stored and protected during the project, how data will be shared after the project, who is responsible for data, etc., etc. So the DMP is really designed to help you handle all these aspects, because of course these are really important questions you have to ask yourself even before DMP existed. But this new document will help you focus on all important aspects regarding data. So how to create a DMP? For the ERA PerMed projects, there is a precise template to fill, and other funders may use different templates, but in general, the same elements are present in all templates. So in the ERA PerMed template, you have firstly the description of the data, then data collection, generation or reuse, data management, documentation and curation, data security, data sharing and access responsibilities, relevant policies on data sharing and data security, and of course the author of the DMP. So you have to answer to all these questions, but don't worry, it's not that difficult. A few tips to begin with this kind of document, well, as Monika said, is to work on your DMP as soon as your project begins. Even if you are in the full proposal stage, it's really important to have the template in mind and to ask yourselves if your project is producing data or not. Will you be able to reuse it, to share it, etc., etc. So it is really important to think the DMP as a team output. Even if you have a coordinator, which is the main author of the DMP, well, it's really a work team. And also, don't hesitate to ask librarians for help, because a growing number of librarians are specialized in data management. So if you have any trouble with this document, I'm sure that in your university or in your institution, you have librarians who can help you. So what does a DMP look like? Well, it's like a really common document with questions and answers. The questions, of course, depend on the DMP template, and you must have detailed answers to the different questions. But the document isn't necessarily very long. It's in general 4 to 8 pages, so it's not a really important and very long to complete document, but it's really important in order to have good data management habits. So what are the benefits? Writing a DMP basically allows you to avoid most of these really tricky problems. So for example, having to deal with large quantities of data you don't know where to store, or having trouble when exchanging data with your partners because you haven't thought of naming conventions, being in the impossibility to link your data to your publications because you haven't agreed on data property, or maybe losing your data at any moment during the project because you don't have a safe storing solution, or again, forgetting to collect metadata and being incapable of interpreting all data. So you have, these are the most common problems in data management, but there can be also more problems, and the DMP will address all these issues. And an important point also is that the first DMP you will write won't be perfect, of course. For some questions, you will have difficulties to answer simply because your project is just beginning. For example, what is the volume of data produced? Well, of course, it's really hard to answer to this question at the beginning of the project. So the DMP must be addressed as a living document, which is meant to evolve through time during your project. And well, that's what's interesting about it. It's since it has to be updated regularly, you will have reminders in due time to remind what you have to do regarding research data. So in short, DMP is your best friend to avoid problems regarding data, and you don't need extra difficulty in a research project. it is a collaborative document. So get in touch with librarians to get some help if you have any trouble with the DMP. And to finish, the experts such as myself who will review your DMP are not disciplinary specialists. So you have to be clear in your responses. You need to have in mind that it's not the scientific quality of your project that is reviewed in the DMP. It's really the way you are addressing all data management topics. So it's not a document for disciplinary specialists, but it's really a document regarding the management of your project. And of course, if you have any questions regarding the data management plan, you have my email address, and please feel free to contact me with any question. Thank you very much.
Thank you very much, Laetitia. Thanks a lot for presenting. I think that your presentation was very clarifying. I don't know if there are any specific questions, but I think that as you have to leave very soon,
yeah, I can stay a few minutes and then I leave. I'm so sorry again.
I didn't see any. No, don't worry. I didn't see any question related to the data management.
I only saw one that I already answered because it was regarding the template that is available only for the funded projects. It will be available in the website for the full proposal phase, but only funded projects have to present this data management plan after being elected. But if in case that anybody is interested in consulting this template, the one from the previous call is available still in the website, so you can refer to this document there. And if you have any specific questions, Dr. Bracco, I think is available in her email address. Thanks a lot for your presentation again.
Thank you.
Now we can pass the floor to Dr. Griessler, please, if you can upload your presentation.
So thank you very much for the invitation to give a very short talk here and sharing my experiences as evaluator. My presentation is called Ethical, Legal and Social Aspects in ERA PerMed Proposals and Evaluator Perspective. So please take notice that this is a very individual, very personal experience and the lessons I'm drawing. So this is in no way an official standpoint of ERA PerMed. So it's only my experience. I'm a strange animal here. I'm a sociologist and historian by training, and I'm working at the Institute for Advanced Studies in Vienna, and I'm head there of a research group called Science, Technology and Social Transformation. And I have been involved in ancillary research for many, many years now on transplantation, xenotransplantation, genetic testing, assisted reproductive technologies, and other topics as well. And I would like to share with you the personal experiences I have from evaluating this kind of interdisciplinary proposals and calls. So let me start with my first experience. What does ELSA actually mean? Many proposals, in my experience, misunderstand what ELSA research actually means. ELSA research means that the project raises ethical research questions which address the ethical, legal, social aspects of the research you carry out and or the area it addresses. So in certain ways, ELSA research is reflecting your own research and adding to your own research. And I think Dr. Frenzel already mentioned very often that you should look at the call. And I think the call gives very good examples for what kind of questions this could involve. So I want to point you here to the call text on page 13. It says, for instance, questions of fair and equal access, or question of acceptance of the public, health professionals and policymakers for access to preventing screening, or the right to know or not to know, and sharing of research findings, or therapeutic educations of citizens and patients, research on the role of genetic testing in clinical practice, research, just a second, research on advantages and disadvantages of genetic engineering. Research if you're using ICT or AI, bias, the question of biased data set. Is your data set in a certain way biased? How would you find out? How does your research project change the collaboration of different professions? How to enable stakeholders exchange and collaboration? Regulations of your research, strategies for regulatory approval of clinical decision systems, ethical, legal, and social aspects when using automatic support tools. So I think if you read what is written on page 13 as examples for research questions, and you could think on about your own project, whether this is the case and how you could reformulate these research questions for your own research, this is already a very big step. I hope this doesn't confuse you, but I try to make it very, very clear. What ELSA does not mean is, ELSA does not mean that the project is meeting ethical and legal requirements. For instance, informed consent, data protection, protection of vulnerable groups, submissions to an ethics committee, etc. This is a natural given. This is something which should be done anyway. ELSA means really social science, research in social sciences, humanities, and law about the topic you are doing research on. And let me add to what my predecessor speaker said. In contrast to the data management plan, the ELSA part, this is a review of the scientific excellence, but it's the review of the scientific excellence, not of the scientific and the medical part. It's the review of the scientific excellence of the ELSA part, of the social science part. So what is my personal lessons from an evaluator's perspective? First, proposals regularly mention that they want to integrate ELSA. So if you read any proposal, tick box what is written in the call text and mention it in one way or another. But the question then is it really connected also to activities? And this is very often not the case. So there's often a misunderstanding, as I said, that ELSA means meeting regulatory requirements. That's not the case. Meeting regulatory requirements means meeting regulatory requirements. ELSA research is a research. Therefore, often applications and proposals lack a proper research questions. So what do you really want to, what kind of research questions do you want to solve in your project? Also, very often they lack proper research methodologies of social sciences, how to answer these research questions if it's posed. So what are you doing? Are you doing surveys? Are you doing interviews? Are you doing document analysis? Are you doing experiments? So what is your method? Very often, a very important thing is that ELSA research is not something for the sake of itself. It somehow has to be connected to the research project, to the medical research project and the scientific research project itself. So for instance, if you involve patients, if you look into biases and so on, then you have to, sorry, I have to take away my cat from home office. You have to make very clear how the ELSA research is adding to your medical research and your scientific research. How are these two areas connected? How are the learnings of the ELSA research recognized and inform the medical research? For instance, if you detect a bias, how do you deal with this bias? If you detect a certain gender aspect, how do you deal with this gender aspect in your research? So it's not just that you do a certain isolated ELSA research, it's also to show how you connect your medical and scientific research with this ELSA research. What I also realized very often that although it was mentioned that there will be ELSA research, this was somehow an add-on. And there was not an individual ELSA work package where you really developed your research question, your methods, your research plan, and so on. And very often the researchers lacked the competence and experiences in the social sciences to carry out this research. So for instance, if you do surveys, if you do interviews, if you do document analysis experiments in the social sciences, you have to show that you have the proper training for it. It's not enough that you think, oh, I can do this on top of everything else. Another personal lesson, and this is something which was already mentioned by Dr. Frenzel as well, is this patient involvement is very strongly encouraged on page 16, but often it lacks the proposal lack proper patient involvement. Sometimes it happens that only medical experts are involved, and this is considered as the medical experts are considered as spokesperson, spokespeople for patients, for instance. So I think this is not enough. I think it's also very often the case that it's very unclear why, when, who, and how these patients are involved. And it's also unclear how this patient involvement is also not something done for the sake of itself, but it is something that should improve your research and should inform your research. You should also make clear how the input from patients and patient organizations informs your own research. When and where and how. How are you going to do it? Then also the call strongly encourages the inclusion of sex, gender, and analysis or underrepresented populations. This is also something Dr. Frenzel already mentioned. And here again, it is not clear very often. It's only mentioned as a tick box, but it's not really shown how this is done, who is going to be involved, and how is this integrated in the project? How does this really show in your research results? So some personal recommendations from my perspective. A proper ELSA research question is very important. It's essential. The call provides good guidance in this respect on page 13. Read it and take it serious. This is also the case in patient involvement and inclusion of sex, gender analysis and underrepresented populations. Here also the call gives very good guidance. As in all other parts of your proposal, describe how you are going to answer the ELSA questions. What methods will you use? What data will you use? And so on. And also, I mentioned that already, show how the ELSA research informs the entire project. Define very clearly at what point of time, what kind of links are made in order to get the information from the ELSA project to the other parts of the project and from the other parts of the project into the ELSA project. Try to involve patients throughout the research project. This is also something which is written in core. And I already said that about the gender dimensions. I think what is also very important is try to find ELSA researchers to collaborate. In research community studying science and technology study, anthropology, sociology, responsible research and innovation. I think the partnering tool is a very good way to find colleagues in the social sciences, humanities and law to help you with that. Set up a dedicated work package for ELSA research. Don't make only an add-all in which the research questions, methods, workflow, interaction with the other work packages and stakeholders is clearly set out. Provide sufficient funding for ELSA research. There is I have to praise my own project, which is New Horizon, which developed a societal readiness thinking tool, which might help you to address these questions easier. So there is a link there, you can find that, and I think the slides will be available for you. And there are other resources as well you can use in order to get more information about responsible research and innovation and about ELSA research and how to better integrate that. So thank you very much, and I hope I was somehow in time.
Thank you very much, Dr. Erich Griessler. Thanks a lot for your presentation.